Good evening, ladies and gentlemen. Am I sounding clear? Okay. So, digital technologies. Today continues, the digital technologies today continues to offer an unmatched capabilities and proactive solutions to the healthcare workers, which manifests itself into the latest discoveries such as electronic health records, AI advances, analytics, and smart data, robotics, and software. Thus solving the current productivity challenges by improving accessibility while enabling more precise patient diagnosis and treatment, which in turn shorten the patient healing journey and lower overall cost. As we reflect back, the healthcare sector has been at the forefront of COVID-19 pandemic, facing several layers of challenges as it attempts to improve the patient services, offer quality care, and offer early detections and diagnosis, thus saving time, resources, and of course, saving valuable time. Let's go back on time and see how the healthcare set on the broader context of human being evolution. This very interesting chart depicts the story of human, where it took humankind to reach the first billion of population thousands of years, precisely until the 18th century BC. Then, with the power of innovation, the line has flipped and the trend exponentially grew in the last 3 centuries, producing an additional 7 billion living in this planet, which simply means that we are racing to take care of these billions, and we do not have the current system, or the current system simply cannot do it physically by itself. We need another enabler, and the magic lays on the digitalization as an enabler to this new paradigm. The extraordinary growth we've seen in the previous chart is attributed mainly to the agricultural industrial revolution that started with the steam engine and ended up with the IR 4.0. On the contrary, we still have ways to go. We have around 50% of the world population connected to the internet only. Yet, this gives us the unprecedented advantage toward accessibility and mobility, and also this expected to increase to reach around 100% on around 2050. With the current revolution in technology, we've added around 20 years of life average global expectancy. This means more resources needed, thus we need, by having these aging population coming as a wave. But keep in mind, gentlemen, connectivity, as we've seen earlier, is not enough. It is the speed and quality of connections which enables more advanced solution. This can be described by Nelson Law. What is Nelson Law? Nelson Law shows that it's expected to have 50% growth of internet speed and bandwidth every year globally. In other words, the tsunami of data is yet to come. Anyone here is a surfer or likes surfing? Nice. What to do when you know that you have a wave coming? You just go and ride it, okay? As a healthcare providers and healthcare in this sector, we need to face this opportunity in which we can ride the tsunami of data, building on the 4 key digital enablers. First, we can build on the current rapid increasing adoption of transitions to cloud computing and cloud healthcare, which in turn means that it gives us a noticeable rise into the data analytics and solutions. Also, as mentioned earlier in previous sessions, that Nelson, or previous slides, that Nelson Law is giving us more advantage by having good penetration of internet speed toward rural areas and other disadvantaged areas. Finally, the advancement of sensors technology that has greater impact on the better proactive interventions and monitoring toward our patients. Now, gentlemen, nevertheless, ladies and gentlemen, nevertheless, in order to pioneer the changes in healthcare, we cannot ignore the trends underpinning how to deal with the future of healthcare. And those trends mainly get shaped and reshaped by the fundamental element of human action, which is behavior. As Dr. Patel has put it just nicely in the quote, human behavior is the final common pathway for the application of nearly every advance in medicine. Behavior gives us the ability to predict and proactively bypass the hurdles leading toward the preventive care that we aspire to have. For example, predicting the rate of diabetes or cardiovascular disease by simply tracing back to the behavior of just excessive smartphone use. That goes through the development of stage of lack of sleep and increasing anxiety just simply by that. So, allow me now to talk about the 4 major trends that will reshape, and we think will reshape how the healthcare will go through in the upcoming years. The first trend that we see is the mobility. Especially after COVID-19, there has been an upsurge of on-demand healthcare, and as a definition of mobility has been redefined, we see that job, offices, commuting to work, and activities has been reshaped completely after the COVID, where the flexibility and use of online delivery or online solutions, which enables more reach globally and allow anyone from anywhere living to have a high standards of healthcare provided at an easy reach and at our fingertips. This wasn't possible without quality integrations and innovative solution between the different advanced system that allows easy online booking, video conferencing, digital prescriptions regulations, and integrated payment gateways. And at the end, home delivery that permits an easy and smooth process. The other major trend that we've seen, the wider and improved capability of data collections, enabling more precise diagnosis. And for instance, the sensor that will be part of our cloth fabric in our day-to-day, which tracks our bioactivities, and these wearable devices will have the ability of digitalization, where patient can have an e-patient record tracked and logged via blockchain technologies, and will be able to access anywhere, anytime, and with the security, privacy, and proper permission. Patients now are seeking more than ever faster responses. For example, it has been seen that people are saying we need a responsive and sustainable healthcare, which means that we need to have faster responses and diagnosis in the near future. This leads us to the next third major trend, where we live in the virtual century. Literally, we are in this metaverse or something like that people are saying it. This virtual experiences in communication and lifestyle has been the new norm, or will be actually the new norm for our next generations. We need to think about, literally, the patient journey. How to infuse more sensation and immersion into the experience of the patient. And these immersive experiences will be via digital solutions that will be substituted substituting the physical journey that we have already. Actually, with this virtual century, we can have better customization and effectively have to alter and personalize the patient journey to utilize big data and collect more data in order to improve more and more with less cost the user experience or the patient experience during his healing journey. The fourth and last trend that we've seen, that as we recover from the pandemic slowly, still a scar has been there from those days that completely revolutionized how people and individuals and businesses look at health. And now everything, literally everything, is revolving around health. We are health-centric, human beings so far right now in this day and age. And attracting better workforce for businesses and environment, the environment will depend on giving more attention to health for customers and for employees. Health now is everyday preoccupation. As we are, as healthcare leaders and providers, we have to think literally how we can realign ourselves with all businesses and ecosystem to ensure businesses thrive and success around health-centric system. In our age of digitalization, I personally still believe that AI and all advances of technologies can automate things and can scale toward reaching millions of people who are in desperate need for support. However, I still have this question, which is, still we bear the responsibility to understand that there is a fundamental aspect that we embody as a human being, which is that we are an emotional human being. We cannot lose ourselves and start turning our body into machines just surrounded by sensors, that's it. We need to move on the sensation that we experiences during the pain. I think you all have been in that situation where you have been in that situation where you have a deep pain surrounded by machines and tools and sensors that actually strips you from the essence that we need to connect with our fellow humans, not just literally machines or tools or sensors. I believe that the AI will take us or take care of the automation of all routine work of doctors, nurses, surgeons, even surgeons. But the missing part that we need to ask ourselves is the notion that I call compassionate healthcare, in which you feel the love, you sense the soothing touch, you truly and sincerely care, which I believe we cannot just replace by other machines. Can we think again as healthcare leaders and have the right healers who combine knowledge, experience, and technologies, and at the end revolves or surrounded by what I call compassion, to truly have an accessible and life-changing healthcare at our fingertips. Thank you very much. Any questions, gentlemen? Nothing? Thank you very much, gentlemen.